today. I have an Associate of Substance Abuse Counseling degree, a Master's in Social Work and Mental Health, and a PhD in Social Work, and my expertise is sex addiction. I have been working in Arizona primarily with people who do not commit sex crimes. I have seen over 600 men every year for 15 years seeking my help for pornography compulsion, and I've been very successful in helping them. I don't advertise. It's all word of mouth that people tell each other. At this point, I am seeing the spouses and the children and serving 4,000 families in the past 4 years. What's most disturbing to me about the sex education is that people are being exploited. You know, it is unethical when people say our sex ed program is medically accurate, medically acceptable, and medically accurate. It convinces people to trust something that should not be trusted, and I'm very disturbed about the lack of accountability. I really work hard to help people understand how easy it is to hold people to accountability. When you look through sex ed programs for 10 years now, if you just put the word anal, it almost always appears after vaginal, oral, or anal sex. And the curriculum, the sex ed curriculum 10 years ago was being developed that by the 5th grade students should know there are 3 forms of sexual intercourse: vaginal, oral, and anal. And there are 4 ways to do sexual intercourse: penis, fingers, tongue, and objects. I was very disturbed by that and tried to help people know that that's being promoted. I do a lot of research science, and I make it public to the people. And I thought about how the words for Arizona sex curriculum research science. For Arizona sex curriculum research science, it's FASCRS. If you go to FASCRS.org, if you can do that right now or just write it down and look at it later, it's the Fellowship of the American Society of Colon and Rectal Surgeons. The American Society of Colon and Rectal Surgeons is dedicated to ensuring high-quality patient care by advancing the science, the prevention, and the management of disorders and diseases of the colon, rectum, and anus. This promotion, for 10 years that I have known in the schools and in the library, materials for children, this promotion of anal sex is quite easily researched by anyone today as being a medically inaccurate promotion. Under the FASCRS.org, you can choose the material under patients, members, I forgot the third, but if you click patients, you go straight to education for the public, and they have a list of diseases. In that list, you see anal cancer, but if you scroll to the bottom, it says view more conditions, and it has anal cancer expanded version. And I'm very grateful that they've gone in and really beefed up this stress that no one should ever engage in anal sex. In the overview, it says that anybody wishing to learn more about anal cancer should know, and it's 3 dots, how to prevent anal cancer. They give you the cancer rates, and these are constantly changing. For a long time, anal cancer was very rare, and it has been increasing over recent years as anal sex is promoted. I don't know how old this statistic is, but it's the one on the website now. It says 6,000 new cases every year. 2/3 of those cases are in women. Approximately 800 people will die this year. So then they cover the risk factors for anal cancer. It says that most people seem to think you can't get anal cancer unless you have an HPV infection, and that is not true. It says some people develop anal cancer without any clear reason, but the risk factors include, number 2, anal sex. Number 2, people participating in anal sex, both men and women, are at increased risk. Number 3, people with multiple sex partners are at higher risk because they are exposed to STDs. Preventing anal cancer. You can read straight off of their paper. This is medically accurate. These are people who are professionally looking at the effects of anal sex, saying few cancers can be totally prevented, but the risk of developing anal cancer may be decreased significantly by avoiding the risk factors listed above. Of course, it recommends regular checkups. When you're teaching children that anal sex is a way to be safe and avoid pregnancy, no one is knowing to have all these checks of the anus on a regular basis. When you bring children to the doctor, it's not a common part of the examination. It talks about the HPV vaccines and says who should receive these vaccines remains a matter of discussion. So there is still controversy, even among professionals, about how we best protect our children, but it is very clear that nobody is being held accountable for promoting a program that, I can't remember the year, I think in 2004, Dr. James Hildreth said, these ideas are putting children at greater risk, not lesser risk, and that he said many children believe they can remain a virgin by choosing oral or anal sex. Up to 20% of people do not have any symptoms, and sometimes by the time there's symptoms, it has spread to the liver and the lungs, and that is all written here in what they talk about, and how difficult it is to do anything about it at that point in time. I really am in support of the bill, and I want people to do some research, to look online and see what you can find, that these programs are not medically accurate, and they are not following what medicine knows to be good advice for anyone, especially children. I appreciate your attention. I'm grateful to have a chance to speak today. Thank you.